Welcome and thanks for joining us. My guest today is Rob Shriver, Acting Director of the Office of Personnel Management. Acting Director Shriver, thank you for being here and joining me this morning.
Thanks, Drew. It's great to be here.
Absolutely. So we know that open season is upon us for the 2025 plan year, but we also know that each year less than 5% of enrollees in the Federal Employees Health Benefits or FEHB program actually make changes to their plan options during open season. So, Acting Director Shriver, from your perspective, how is OPM trying to raise awareness of the options that are out there and just really try to raise those numbers for participants?
Yeah. Well, thanks, Drew, for bringing attention to the fact that we're embarking on our next open season. And with every open season, our priority is really that federal workers and their families have coverage that meets their needs. And so during every open season, we want to give enrollees the opportunity to review their coverage, compare their coverage options, and make sure that they're making the choice that's right for them. And that may be making changes to their coverage. They may change carriers. They may pick a different plan with the same carrier, or they may keep their current coverage. But we're always encouraging people to take a look at the options, take a look at the new options available to them, and shop for coverage. There's a lot of stuff that we have been doing to support employees who want to shop for coverage. So we have a lot of information on our website. It includes the summary of benefits rates and health plan quality. And we also have plan comparison tools that the FEHB members can take advantage of. This year, we're rolling out the new Postal Service Health Benefits Program, and there's a new plan comparison tool there that's going to be part of that program that we're interested in people to try out. So I'm certainly encouraging the postal workers and annuitants out there to take a look at that new plan comparison tool because we'd like to see how it goes with postal and then hopefully get Congress's support to be able to roll it out for the FEHB enrollees. And then if you really want to get into all of the details of the health plans, we produce what's called their brochures, and that's not just like a little document like the health plan brochures. It's kind of a term of art, Drew, and they have all of the information on the health plans, dental plans, vision plans, describes the benefits and the rates in great detail. So all of this information is available at www.opm.gov/open season. And then we always encourage folks to follow us on X, formerly known as Twitter, and LinkedIn. We'll put more information out there about open season. So that's at USOPM or the U.S. Office of Personnel Management.
Thank you so much, Acting Director Shriver. That's really helpful to know that there are a lot of those resources out there. I also want to pivot a little bit here to talk about some other aspects of open season this year. Some enrollees, I understand, might be feeling a little bit worried or concerned about the rising premium rates in the insurance program that we've seen for the last couple of years. This year, especially, premiums are rising pretty significantly, 13.5% on average for the federal program, and then over 11% on average for the participants' share in the postal program. What can you tell enrollees for maybe the reasons behind those rising costs? And is there anything that you can say that might help alleviate some of their concerns?
Sure, Drew. Happy to address that. And, we're always striving at OPM to make sure that federal employees and their families get the best health coverage they can at a fair price. And so you're right. There have been rate increases this year for the FEHB and the plans that are in the Postal Service Health Benefits Program. And those are pretty consistent with market-wide trends. For example, CalPERS, which acts as the health insurance exchange for public employees in California, is reporting an overall 10.79% average premium increase for 2025. PwC is projecting the highest increases in commercial health spending in 13 years. And these premium increases are driven by impact of price increases by providers and suppliers, increased utilization of certain prescription drugs, and behavioral healthcare spending. So, with all of that said, that's why the FEHB program is such a great benefit for federal employees. It's because it's the largest group health insurance program in the world, and we actually have 130 total plan options available to federal employees at a range of price points. So, if you're somebody who is concerned about an increase in the premium in the plan you're currently enrolled in, you are exactly the kind of person who should be taking a look at the other options that are available to you this open season. And let me just give you some examples, Drew. So there are 21 FEHB plan options that are offered on a nationwide basis. So open to everybody, right? One of those, the enrollee share of the premium actually declined compared to 2024. And then there were three of them where the enrollee share increased by just $2 to $9 on a biweekly basis. Among HMOs, there was generally one or more plan options in each state where the enrollee share decreased from 2024 to 2025. So you see, like, if you shop around, you can see that there are different options available at different price points. And if they offer the kind of benefits that you're looking for and the kind of networks that you need for your providers, you can save money by shopping around.
Right. I do think that's a good point that you're making is those premium increases are an average. So the 13.5%, the 11%. So of course, some plans will be less than that, some will cost more, and then it's just dependent on your healthcare needs, of course, too. And one thing I do want to kind of point out here is that the Federal Employees Benefits Survey that OPM administered just a couple months ago it was found that 81% said out-of-pocket costs were a top factor for them when selecting a health plan. So I think that just kind of shows, how important cost plays into open season and just making those health insurance choices. But I do want to turn a little bit towards some of the benefits and different options that are going to be available for next year. Can you give an overview of any significant changes in coverage options for enrollees this year? I know IVF was a big change. Anything that you can share there or anything else that OPM is focused on this year?
Yeah, sure. As you mentioned, we have expanded fertility coverage in the FEHB plan, and this has been a multi-year effort. So we initially had required all FEHB and this year postal plans to cover all forms of artificial insemination and the drug costs associated with IVF procedures for up to 3 cycles annually. So that's the base benefit that's available for fertility. And then we've been working to expand comprehensive IVF benefits. And so for the 2025 plan year, the FEHB overall program wide is providing 25 plans who are offering 45 plan options that offer IVF coverage above the required benefit level. And in fact, we added a new national plan this year. So now we have two national plans that provide comprehensive IVF coverage. And I think that's a big deal. Part of what we strive to do, Drew, at OPM is position the federal government as a model employer, and that includes offering benefits that are competitive with the private sector. And providing comprehensive IVF coverage is something that is important to our enrollees, and we're happy to be able to offer not only access to everyone in the FEHB who wants IVF coverage, but choice in carriers and options there. So that's a big deal. For plan year 2025, we're focused on integration of Medicare prescription drug benefits into the FEHB. And so we've accepted proposals from FEHB carriers that feature automatic group enrollment for Medicare prescription drug plan employer group waiver plans. This is one of my all-time favorite government acronyms, Drew, the so-called egg whips. And so what these employer government waiver plans do is they enable FEHB and Medicare dual enrollees the ability to benefit from the prescription drug savings that result from the Inflation Reduction Act. Eligible FEHB members who are auto-enrolled may also choose to opt out and receive the FEB's plan prescription drug benefit if that's what they want to do. So for 2025, we've got 3 additional of these egg whip proposals. That brings the total number of FEHB plans that have this to 11. So that's a big deal. We also have important changes regarding coverage of FDA-approved anti-obesity medication. So for the 25 plan year, all FEHB plans will cover anti-obesity medications, and the rule is that the carriers have to cover at least one anti-obesity drug from the GLP-1 class for weight loss, and then also cover at least 2 oral anti-obesity drug options. We've also emphasized that carriers must offer comprehensive behavioral therapy that cover appropriate diet and exercise regimes for those folks who are prescribed anti-obesity medication. And 2 more things real quick: access to and availability of mental health and substance abuse treatment. So we have emphasized the access and availability of behavioral provider networks, and done that in view of the recent crisis around the COVID-19 pandemic, youth mental health, the opioid epidemic. So our plans are expanding access to behavioral health services by reimbursing behavioral health services offered in primary care settings. So that incentivizes greater coordination among behavioral health providers and other providers in the health system. And then we've also taken measures to address inequities in maternal health. According to the CDC, 50,000 women in the US each year experience pregnancy complications or severe maternal morbidity. For these reasons, in the 2025 plan year, 64 FEHB plans cover mental health treatment for postpartum depression, 51 plans cover certified nurse midwives, 43 cover delivery at birthing centers, 46 cover nurse home visits, and 30 cover doulas.
Thank you. Thank you for going through that. I think it's going to be just important to hear what the benefits are that are available in the range or the scope that are going to be in or available to, at least to even look at during open season this year. And you alluded to this a little bit already, but can you talk about, why those have been areas that OPM has prioritized for the last couple of years? I mean, maternal health, mental health, gender affirming care, all those things. Can you talk a little bit about why OPM is focusing on them?
Sure, Drew. So, as I mentioned, we both strive to be a model employer and help make the federal government a model employer and offer benefits that are competitive with the private sector. We also are a market-based system, and so what we do is we work with the health insurance carriers to make sure that the benefits that they are offering in the broader health insurance marketplace are available to federal employees, annuitants, and their families. We rely on the surveys that we do. You mentioned the Federal Employee Benefit Survey as an example that identify the types of benefits and other priorities that our federal family is looking for in our benefits program. And so we take all of that information and we negotiate with the carriers on an annual basis to try to get the most comprehensive benefits at the best price point for federal employees. And certainly some of the areas that you've mentioned have been topics where there's been a lot of interest in seeing the FEHB offer benefits. Often we kind of build these benefits year after year. I went through the IVF example where we started with a baseline level of benefits and then negotiated for more comprehensive benefits and now have expanded so that there are more carriers offering the more comprehensive benefits. That is pretty much a typical approach that you see with how we try to advance the benefits packages available to federal employees. Again, they're very much driven by what's available in the market. We try to make sure that we are competitive with large employers in the private sector and that we're being responsive to the needs that are identified by our customers. And then we take all of that information in and we issue a letter to the carriers each year, a call letter that identifies what our priorities are going to be when it comes time to negotiate over benefits and rates. We carry out that negotiation process, and then we come to open season and we talk about all the great new benefits that we've been able to make available with federal employees.
No, I think it's helpful to hear that whole process kind of laid out. So thank you. Let's talk a little bit more specifically too about the new postal program. That's a big undertaking that OPM has been, I understand, working on for at least the last couple of years. Um, with anything new, you're going to get a lot of questions from people who are being impacted by this. From your perspective, what's most important for participants or new enrollees in this postal program, to know as we're heading into open season?
Yeah, Drew, we're really honored that Congress gave us the responsibility of launching the new Postal Service Health Benefits Program as part of the Bipartisan Postal Reform Act that it put into law. It's going to cover nearly 2 million postal employees, annuitants, and their families. I have some experience in the Affordable Care Act exchange world, and I can tell you that that group of 2 million people, that is larger than any of the exchanges at the state level that were rolled out under the Affordable Care Act. So this is a really major project that we have going on. And it's launching, and I am confident that we're going to have a successful launch. We're going to meet the needs of postal employees, annuitants, and their families. Some of the things that are really important for folks affected by this to know is that our priority is to our priority is to ensure that every person is covered. We don't want there to be any breaks in coverage. So one of the things that we did is we have rolled out an auto enrollment feature. That means that if a postal employee or an annuitant doesn't do anything during open season, they are going to be automatically enrolled in a health plan that's comparable to the one that they had under the FEHB program. So if you are somebody who's an enrollee in this new postal program, you'll receive a letter in the mail that tells you what the plan is that we will enroll you in if you take no action, and we'll identify for you the composition of the family that we have in our records. So you'll see that your family members are there and that your health plan is there and that that's what you're going to be enrolled in if you do nothing. So if you get that notice and everything looks right to you and you're satisfied with the plan that you'll be automatically enrolled in, and be the plan that is the closest to the plan you've had in the FEHB. So the vast majority of cases, it's the same carrier, the benefits are equivalent. So that's what you'll be enrolled in. You don't have to do anything. If you take a look at that and you want to make a change, then you're going to be able to come on to the new Postal Service health benefit system during open season. It's going to be a new online portal, and you can make whatever change that you want to make that way during open season. So that's the most important message that I want the postal employees, annuitants to understand, is that we're not going to leave you without coverage. You don't have to do anything. You'll be automatically enrolled. If you want to, you can start looking now on opm.gov. We have a landing page for this new postal program, and we'll have their information on enrollee eligibility, a plan comparison tool, a mapping table that shows how we've mapped the FEHB plans to the Postal Service plans, specific descriptions of any plan level reductions and cost sharing for Medicare enrollees, and information on the newly developed PSHB system that you'll use in open season. So there's information on opm.gov on the special postal landing page, and then If you need to make changes, you'll do that in the new system starting with the beginning of open season.
Thank you. And just going into open season this year, what are you going to be looking for in terms of just launching this big new program for postal employees? Are there possibly ways that you're going to be looking to build out the program in future years, or any take away any lessons learned, for example, from this launch year?
Yes, Drew. I think there's going to be a lot of lessons learned, and I think this is going to be a really important project for OPM. We are building this system the way a modern health benefit system is built. It features a central enrollment platform, a modern IT system, and with decision support tools that will help postal employees, annuitants make the choice in health coverage that's best for them and their family. It is a model for what we would like to do moving forward with the federal employee health benefit program overall. Right now, that program has been built as a decentralized program where a lot of the activity that happens between the employee and the carrier, or the employee and the agency, as opposed to this approach with the postal system, where we have a central enrollment platform that will just give us better data, better analytics, a better opportunity to advance program integrity, and ensure eligibility is being done correctly. So it's a really big deal for us. Now, this is also a change management exercise, because people who have participated in the FEHB for years, like the postal employees and annuitants who are moving into this new system, they're used to a different way of enrolling in coverage and shopping for coverage. They're not used to a central enrollment platform like this. So our focus has been both on successfully delivering the new system and also providing extensive customer support, so that we can help people get through what is really a change management exercise in the way that they're used to engaging with the health benefit system for the federal government.
And one other important statistic I kind of wanted to point out, again from that Federal Employees Benefits Survey that we both referenced earlier. On that survey, less than 2/3 of respondents agreed that the last time they selected or switched health plans, they felt like they had enough information to choose the right plan for them. So of course that means the other about 1/3 felt like they didn't have enough information to make that decision. Obviously, you've gone through a lot of different resources, the plan brochures, things on OPM's website, the information that is available. So I'm curious, what is your kind of reaction to that finding, and are there ways that OPM is really trying to push that information out to make sure that enrollees have it at hand when they're making decisions during open season?
Yeah, Drew, there is a lot of information for people to sort through and trying to figure out what health plan is best for them. I'm really excited about the new decision support tool that we'll be rolling out for postal employees and annuitants in the postal system. I think it's going to be a great kind of almost like a pilot project for what we want to do in the FEHB. It should help people with exactly the issue that you've raised by providing them plan comparison information in a more user-friendly way, allowing them to compare benefits in a more user-friendly way, enable them to check their providers and make sure their providers are in the plan's network. And it's something that we're going to build out on over time. And then hopefully, as I said, if we can win the support of Congress to get the funding to be able to then roll that out for the FEHB overall. In the meantime, we try to do some additional work in areas where we know there's attention, or maybe there's been changes in benefits. So we put together some decision support tables that help people understand the new IVF benefits, or understand the anti-obesity benefits and how those maybe have changed from last year. So we will continue to try to do that, to identify areas where there either is a lot of interest and attention, or where there's been any significant change and make sure that we're providing that information in a user-friendly way to customers. I guess the other thing that is always a fail-safe is uh, federal employees can call their plans, their health plans, if they have questions about the benefits that are being offered, if they're looking at the summary of benefits and coverage, or if they're looking at the plan brochure and they have questions about what they're seeing. The health plans have customer service lines where people are set up to be able to answer those kinds of questions as well.
And just quickly wrapping up here, Acting Director Shriver, what is the final message that you would like to leave with our audience today, about open season and maybe why they should participate in it?
Yeah, Andrew. So even if you've been very happy with your coverage and you haven't shopped for a long time, I think it's always good to view open season as a point in time to just check in and like really ask yourselves, is my coverage meeting my current needs? Do I expect that my needs will change during the upcoming coverage year? You know, different phases in life, you have different needs from your health plans. You may have procedures that you know you're going to be doing in the 2025 plan year. So you can take a look at the benefits for those types of procedures. It's also an important time to explore how coverage has changed because it does change from year to year. And it's better to understand that when you still have a chance to change your health plan during open season, rather than to be surprised by that later in the year when you use your coverage and you see that the benefit has changed. As I've mentioned, federal employees have access to the largest group health insurance program in the world, 130 different plan options that are available to them at different price points. And so I'm always encouraging people to shop, take a look, take advantage of all of these options that are made available to you. And it's always important to remind folks, Drew, that open season starts November 11th. I know that's a holiday, but open season starts that day. And we'll be around to support people that have questions on that day. It lasts through December 9th. So make sure that you're setting a reminder now so you don't wait till the last minute. You know, if you wait till the last minute, there's always going to be longer waits if you have a question and you call in, whether it's to the OPM customer service line or to the carriers. You're always going to have a longer wait time if you wait till the last minute. So set a reminder now, November 11th through December 9th. Take advantage of this period. Take a look at your health plans, see what your money saving options are, and make sure that you and your family are enrolled in the coverage that's best for you.
Acting Director Shriver, thank you so much for joining me. It's been an absolute pleasure hearing from you.
Thanks, Drew. Thanks for giving me a chance to spread the message about open season.
Rob Shriver is Acting Director of the Office of Personnel Management. I'm Drew Friedman, and you're watching Federal News Network. I'll send you back to the studio now for more on the Open Season Exchange.